hello. This is my final comprehensive assignment, a physical assessment on Tina Jones. This is my identification, Shirley Wilkerson from the state of California. All right, I'm going to go ahead and get started. I'm just going to do the physical assessments portion since I completed the comprehensive assessment. Here is Tina. I'll greet her.
Hey. I came in because I'm required to have a recent physical exam for the health insurance at my new job. Sure.
Okay, so we will start from the top. Head is symmetrical, hair is thick. In braids, let's palpate her head. No masses. Let's look at these eyes. Okay, a little red on the corners, but nothing abnormal. Going to ask her, follow my finger with just your eyes.
Okay.
Okay, we'll go up, middle. Okay, we'll go up and left, middle, down and left, middle, down and center. And we'll go up and right, and down and right. So extraocular movement is appropriate. Let's look at her eyes. Still a little reddening over here, but same thing on the opposite eye. Let's take a deeper look. Okay. Looks good on this side. And let's take a peek on this side on the left eye. Okay. Looks good. Now we'll check her pupillary reaction. Let's go on the right eye first. Very good. And we'll go left eye. I'll turn that off. Sorry. Okay, so she's Perla, about 3 millimeters in the pupil. And let's check her vision. Okay, Tina, go ahead and what's going on? Read. Oh no. Ah. Why is this not working? You can Read this line. Read this line. Oh. Start from the bottom. So we're testing the left eye.
FP TOZ LPED PECFD EDFCZP FELOPZD DEFPOTEC. I can't read that line. It's too little.
Okay, that's fine. So we will go ahead and test the right eye. Same thing on the other side. Let's read this line.
FP TOZ LPED PECFD EDFCZP FELOPZD DEFPOTEC. I can't read that line. Okay. It's too little.
So she is 20/20 equal bilaterally. Very good, Tina. All right. I'm going to ask her, tell me when you can... Oh. No longer see my fingers.
Okay, I will.
Okay.
Now.
All right. Very good peripheral vision. Appropriate. Let's look inside. All right. It's all clear in there. Nothing reddened. So it's pink and moist. Same thing, pink and moist. Push to the left. Looks good. Push to the right. Pink and moist. Okay. And let's see if her gag is present. And she has a good gag. Let's look in these ears. See some excessive facial hair here and some acne, which same thing on this side. Exterior of the ears look good. All right, let's look inside the ear. Cone of light is present. Very clear. Same thing on this side. Pearly gray, no problems. Let's look in the nose. Pink and moist, no deviation. Same on this side. Pink and moist, no deviation. No drainage, no issues. See how she can hear.
F. 8. W.
Okay, that was good. Let's check on the other ear.
4. R. 9.
Okay, awesome. Good hearing. Everything so far within normal limits. And now, since we're already at the head, we'll go ahead and check for cervical lymph nodes. See if anything is palpable. See, she still has some discoloration on her neck here as well. Doesn't seem to be in any discomfort. Okay, so we did cervical. No palpable nodes. I didn't come back on this if cervical were palpable. Okay, nothing palpable there. All right, let's check her sinuses. Doesn't look to be in discomfort. Same thing, so no tenderness or pain associated with sinuses. Let's check her TMJ. Ask her, open and close your mouth. Okay. Looks good. No clicking, no pain associated. She's got good full range of motion. Now let's palpate her thyroid. She's going to go ahead and drink the water. It's palpable, smooth, no nodules, and no goiter. I don't see any protrusion there. She doesn't really have any history of hypo or hyperthyroidism either. Let's go to her carotids since we're right here at the neck. +2, no thrill. That's great. Same thing on the left. And we'll auscultate. Let's see. No bruit. No bruit on that side. Let's go to the left. No bruit. Okay. Now let's move down to the anterior chest. So we'll go ahead and take a peek here. See that it's symmetrical. Okay, she's got even breathing. Same thing on here. Be very even breathing. Okay. Man, she gets dressed fast. All right, and we're going to go ahead and auscultate her cardiac points here. Go into the aorta. I hear S1, S2. Same thing on Erb's point. Let's go down. S1, S2, no murmur noted. I'm not hearing any extra sounds on the mitral valve. Nope. Okay. Let's palpate PMI. Okay. Non-displaced, no heaves or lifts, so everything's within normal limits there. And we're going to go ahead and palpate the chest again, looking for tactile firmitis. Let's palpate
99.
here. Okay.
99.
And it's equal bilaterally on each side. That's great. And we're going to go ahead and percuss. Listen for areas of resonance. All areas resonant, I believe. Let's listen down here. Areas of resonance. Okay. Now we're going to go ahead and listen. Take a good listen to the lungs. Go back to this side too. I clicked a little too fast. Okay, go down here. So lung sounds are clear in all lobes there anteriorly. Let's go ahead and check out the back side. So here's her posterior chest. See, she's got a little mole here. But I can also see she's breathing equally bilaterally. And she's symmetrical. And same thing on the back.
99. 99. 99.
And phremitis is equal bilaterally in the posterior chest wall. And we're going to palpate for symmetrical expansion here. On posterior lungs, everything looks good. It's symmetrical. And let's go ahead and hear for areas of resonance. Okay, sounds resonant equally in all areas. And we'll go ahead and listen at the back. Okay, again, lung sounds are present, clear in all lobes. Let's go ahead and take a peek at her abdomen. I do see that her belly is a little bit obese, but that's appropriate for her size here. Let's check the sides. See some excessive hair growth, some darkening of the skin, and some striae. But since she does state that she has PCOS, that's actually not abnormal for her. And let's go ahead and do some palpation here. Okay, left upper is clear, no masses. Same with right upper. Let's go into the right lower. And let's go left lower. So soft, non-tender abdomen. Let's go ahead and do some organ palpation. We're going to go ahead and feel for the liver, which it shows it's palpable 1 centimeters below the right costal margin, which is appropriate. Let's feel for the spleen, not palpable, again, appropriate. Let's go for the kidney. Let's feel for left kidney, not palpable and no masses, which again is appropriate. And let's see the other side. Okay, so within normal limit, it's on palpable organs. And let's go ahead and palpate some more. Let's go deep palpation. So it doesn't look like she's uncomfortable. There's no masses there located in the right upper quadrant. Let's go left upper. Same thing. And we'll go right lower. Same thing. No masses. Nothing palpable there other than what should be there. and no discomfort. Okay, so again, abdomen with the normal limits. Now let's go ahead and percuss again for areas of resonance. No dullness. She's tympanic in the left upper, which is normal. Again, same thing in the right upper. Let's go to the right lower and the left lower. Okay, so percussion is all within normal limits here. And let's go ahead and check the posterior, C for CVA tenderness. No. None reported on the right, and let's check the left. No reported tenderness, so that's again within normal limits. Tina Jones is looking good today. Let's go ahead and percuss for liver span. Should be about 7 centimeters. Okay. And here she is, 7 centimeters on percussion, which is within normal limits. So she doesn't have any swelling or masses. And we'll go ahead and take a listen to all these quadrants here. So we're going to go right upper first. All right. So our vowel sounds are present. Let's go to the left upper. Okay, let's go left lower. Very good. We'll go right lower. Okay, vowel sounds are present and active within all quadrants. And let's go ahead and listen for bruit. Feel for thrill on these abdominal arteries. Okay, we'll start on the aorta. No bruit. That's great. Now let's go to the right renal. Again, no bruit. Let's go to left renal. Oh, excuse me. Okay, we'll go here to the left iliac. Again, no bruit. Let's go right iliac. That's good, no bruit. Right femoral, and then we'll go left femoral. Okay. All right, let's check her upper extremities now. So we'll be checking pulses on her upper arms. Let's go brachial. Brachial on the right. +2, very good with the normal limits. No bounding pulses. She's not low or bradycardic. All right, everything's palpable there on the brachials. Now let's go for radials on the right. +2, very good. +2. And while I'm doing all this, I'm also assessing her skin too. Looking for discoloration. I'm looking at her movements, her musculoskeletal. I don't see any deformities and I don't see any weaknesses at this point. So let's go ahead and check her capri fills on her fingers. Starting with the pinky. That's all right. 1, 2. So less than 2. About 2 seconds, which is appropriate on capri fill. And just so we can make sure that she doesn't have any deformity in the fingers, I go ahead and check all of them. Okay. So capri fill is less than 3 seconds on all fingers here. We're going to go ahead and feel around for nodes. We did cervical and subclavicular. Now axillary, there's none present, so she doesn't have any palpable nodes. And now we're going to check for head range of motion. So she's just going to go ahead and move against my pressure. Test her strength. Very good. She's pretty strong here. Let's tilt her head. Go ahead. All right. And tilt the head down. So her strength is noted as 5 out of 5, and her range of motion is present. So let's go ahead. We just kind of checked her range of motion, so I'm not going to check that again. She's got great range of motion throughout her neck. I see it completely through. Oh, is she following my finger? I don't know. So let's check her bicep strengths. And strength is 5 out of 5. She's strong. She's good. No musculoskeletal weakness. I don't see any deformities. She's not showing any signs of pain or discomfort doing through these assessments. And let's go ahead and check her shoulder first before the hands. I like to see that a little bit first. So I'm going to have her shrug against. Pretty strong. Okay. Perfect. 5 out of 5. So optimal strength and range of motion. And we'll test her hand strength. All right. That's great. 5 out of 5. Let's tilt her wrist down. Good. She's got good grasp. So we kind of all just check this anyway right now when we tested for her strength. I could see, honestly, the way she moves, and she's got full range of motion here as well. We inspected the fingernails when we did the cap refill. Fingernails are clean, symmetrical, no clubbing noted. So now let's test some motor skills. So we're going to have her put her finger to her nose. Close your eyes and touch your fingers. Ooh. To your nose.
I can do that.
Okay, let's do it. She's got an appropriate proprioception, good motor skills, and let's test her deep tendon reflexes. Okay, present on the right bicep. Let's go down. And keep going down here, down the arm, test all these reflexes. Very good. And same thing on the other side, tricep. Let's do tricep as well. Okay, so her deep tendon reflexes are present and appropriate. We already went ahead and kind of did all this all at the same time when I was testing for strength. I can also see she has full range of motion. And then I can also see her motor skills with her hands, but we'll go ahead and do this again. Place your hands on your knees and turn them over.
Okay, like this?
Very good. So she's got great motor skills, nothing lacking here, and full range of motion in the upper bilaterally, equal. So let's look at her lower extremities. So first I'm just going to go ahead and inspect them. And again, during all this assessment, I'm also looking at her skin as well. So I don't see any edema here. So that is good. No swelling, no cardiovascular issues there. So let's go ahead and test her cap refill on her toes. I did her hands. But let's do her feet now too, because sometimes that can be disparities. So I like to check both. All right, let's her get comfortable. Check the big toe. 1, 2. Very good. Big toe. 1, 2. Perfect. So she has great capillary refills in the toes as well. And I'm also looking at the feet. I do recall she does have diabetes, and she did have a previous foot wound. So checking for symmetrical on the feet, looking at the symmetry and looking at the skin differences. I don't really see any differences in skin, but her bottom of the foot, I believe on this right foot, was where her previous wound was. Okay, and now let's go ahead and feel for pulses while we're here. And I'll go right fem. Seeing excessive hair here while I'm looking here too. So strong pulses here on the left and right femoral. Let's go ahead and check pulses on the popliteal on bilateral sides. And we'll keep moving down. And I see there's some discoloration here on the bottom of the right foot from that previous wound, which is to be expected, and it looks to be healed. Everything looks good there. Okay, and her pulses are strong and palpable. All right. Okay, now let's go ahead and test her range of motion and strength. So I'm just going to go ahead and test her strength. With these assessments, it really does show their range of motion and their strength kind of at the same time. So we'll check her hip strength. She can move her hips pretty well there. So she's got good range of motion. She's also have great strength there. Let's go ahead and test the ankle strength. Strong. I can already tell 5 out of 5. Pushing against my force. Chest, her knee strength. Okay. Noted as strong. And let's go ahead and test her hip range of motion. That didn't really show us how much she can move there. So that's good. She can move all that. Wonderful. Let's go ahead and adduct. Great. No problems there. Heels toward the ceiling. Good extensions. And let's go ahead and have her flex. Okay. All right. And one last thing, I will have her do spinal range of motion. I didn't really see her move her torso too much or do any bending, so let's go ahead and check that. Okay. Touch your toes, Tina. Good. All right, let's go bend to the side. And do some rotation. Okay. So she has really good range of motion, full head to toe. And let's check some deep tendon reflexes here. Let's check her patellar. Very good on the right. Let's check the left. Very good on the right and the left. Equal bilaterally. Everything's +2. Strong and present reflexes. Okay, Achilles tendon is there. That reflex is present. Let's check on the opposite side. And it's equal bilaterally. Okay, we already checked all this. And we'll do one last thing. Motor skills. Have her just rub her heel down her shin. Run your right foot down your shin.
Sure.
So this way, I'm able to assess not only her range of motion, her strength, but also some neurological movements. She has good sensory. Left foot down your right shin.
Okay.
There we go. And then from here, I've already seen her range of motion on her knees and her ankles, doing those strength testing and also what we just did today on all of her movement. I inspected her toenails when I went ahead and I did her capillary refill, so we'll go ahead and skip that. One thing I didn't like about this is I didn't really know how to range it, because honestly, I would have been doing these things first. So first things first, I would do the vitals. We already have her vitals here on our previous assessment as well. I've already looked at her pretty much head to toe already, looking at her musculoskeletal system, make sure there's no deformities, everything's pretty symmetrical there. I checked out her skin head to toe during all of our assessments. Some things that I noted were excessive hair growth. She has upper lip and cheek hair. She's got some acne, but on our previous assessment, she did state that she has been a recently diagnosis with PCOS, and she's been using birth control, which is actually helping her acne. I also see some discoloration here on her neck, and she did have discoloration on her legs. Her right foot had a previous healed wound, so there's a little bit of discoloration on the right foot. As far as her orientation, we can go ahead and do that now. This is again what I would be doing first, but what is your name and date of birth?
My name is Tina Jones, and I was born on February 17th.
So she is oriented to herself. Okay, let's ask her, what building are you in?
I'm at the doctor's office. It's Shadow Health General Clinic.
Okay, wonderful. So she knows where she is. What is the date and the year?
Today's date is...
Okay, today's date is Monday, March 1st. So she is oriented ×4. She was able to follow all of my commands. She knows her name, her date of birth, where she at, and she's actually here for a complete health assessment for a pre-employment physical, so it can be assumed that she is alert-oriented and comprehensive. Let's see. And we can go ahead and check her pain response. Let's go ahead and check on the lower. So we'll ask her to close your eyes and tell me if the touch is sharp, dull, or soft.
Okay.
Okay, so let's see how her senses are. Let's go for the right side.
Dull.
Good.
Dull.
Good.
Dull.
Good.
Dull.
All right, and then let's go ahead and go to soft.
Soft.
Great.
Soft.
Trip her up a
Soft.
little bit.
Soft.
And now let's go to sharp. See how she does with sharp.
Sharp. Sharp. Sharp. Sharp.
Okay, so she has great sensation. She's alert in orientation size 4. She's wearing glasses. I know her previous health history. She recently just got her glasses about 5 months ago. So we'll try this. So since she does have a history of diabetes, this is a good one for her to test peripheral neuropathy. Want to make sure that she has good feeling in her feet.
Okay, I will.
Okay, so we'll start with the big toe. And let's go here.
Yes.
Okay.
Yes.
Okay, so she's lacking a little bit of sensation here on the big toe on the right side of the foot. Well, let's go ahead and go to the left foot.
Yes.
Okay, and again, limited sensation in the bottoms of the feet, which is something to be aware of for diabetics. So she has already had the history of the wound on the right foot due to lack of sensation. So that's another thing of teaching that Tina will have to be explained is really good foot care for diabetics. Okay, and this concludes our head to toe assessment of Miss Tina Jones. If you would like to see my documentation, it's on the previous assessment throughout this Shadow Health. Okay, thank you.